Okay, good morning, everybody. Welcome. My name is Lance Beck. I'm President and CEO of the Greater Spokane Valley Chamber of Commerce. We're going to give everyone a minute here to log in. I'll run you all through as we have people logging in this morning. We'll run through the kind of order for today's call. So it's a pleasure to welcome you to the Joint Chamber call this week. Again, coming weekly every Thursday at 11. We do plan to continue this as a weekly resource call with the most relevant up-to-date information that we can provide on a weekly basis here. So this week we're welcoming Amber Lenhart, Health Policy Specialist with Public Information and Government Affairs with Spokane Regional Health District. And then we also are having Gary Gemar, Chief Operating Officer for Incyte Diagnostics, as well as a couple of his team members joining us today on the call. And so looking at public health and regional testing capacity here to be able to showcase that to the area here. So looking at the schedule, I also know I've got Cindy Wendell on from GSI for a quick update, and it looks like we're going to have Toby Bromling from the West Plains Chamber of Commerce with us as well today. So we'll turn it over to them for some quick updates here. So Cindy, if you are on the line, I'd like to welcome you to unmute and give us an update on the regional business recovery work groups and where we're at on that process.
Perfect. Good morning, everybody. Thank you, Lance. This is really nice to have the opportunity to give you all an update. Some of you have joined our Tuesday calls. Some of you have been helping us on our work streams. But a quick overview of where we're at is we pulled out testing and PPE as and workforce issues as identified as so important that they really needed their own focus. And so we've got some internal GSI and some of our business community leaders heading those up, and I am active on all of those in some capacity, but we really needed some additional resources to stand those up. For the workforce, some of their top issues are going to be obviously unemployment, childcare. They're really trying to assess. Mark Matkey's been a huge member of that. We've got Nicole with some daycare, with Journey Daycare, really trying to help us figure out what we can do as a community. I know the city of Spokane has elevated this as an issue for them, and so they're looking at those proposals as well. For the PPE, this is within the last probably 48 hours. I wish 2 months ago we had been able to give this the focus it needs, but it is really we're really trying to stand up and figure out exactly what we need to do to help our small businesses have what they need when they need it, and so they can protect their employees and their patrons. And that is the overall goal. How we get there and what the best way to do that is a massive task. We have looked at trying to inventory our local manufacturers, get them connected to small businesses, but we do have national supply chains that are starting to become more robust. I've had a lot of phone calls with small business owners lately, and my top question is, how are you accessing PPE? Do you have enough? And no surprise to many of you small business owners on this group, but they are pretty resourceful and they are finding what they need. My biggest concern is that for the long term, what does this look like? How expensive is it? One business owner told me they bought a bottle of hand sanitizer for 15 bucks and it wasn't that big, but they need it and they're trying to get it. So I am concerned about the cost and this barrier to entry for our smallest businesses, that this is going to, again, become a competitive advantage for our largest businesses, our more national chains, those that have access to larger supply chains. We're really worried about our small businesses. And so I'm trying to reach out and see what the best way is to get them some PPE. And it may be a little more expensive, but they maybe have a better timing if we can connect them to local resources. So those are all being discussed through PPE and testing. We have done a shift. At first, it was trying to reach out to some partners. And I have to give a shout out to Amber. She has been an incredible partner for this task force. And the Department of Health has been very responsive. They've had to answer some really tough questions, but we have really stood up some trying to make sure that everything is defined for this community, that we know what capacity means, that we know where the information is coming from, that we know what the governor's office is getting is what we see and what we know about our community. So when they're making decisions, that they are based on what we believe to be the accurate information for our area. And I know Amber and I have had many discussions, and Dr. Lutz has had many discussions with people as well. And I'm thrilled that we've been able to come together and get some of these issues addressed. And I know Amber will go into some more detail today, but we had another meeting yesterday and really started to figure out how are we going to continue to keep an updated inventory list of the lab capacity. And again, as we switch into more of a multiple wave issues with the virus, how are we making sure that Dr. Lutz has the information he needs to make the right call? Does he know what the capacity is if the numbers start to go up? Does he know how quickly and responsive we can be? Does he know what the supply chain issues are? And again, it has to be a partnership because not one person or one entity knows the answers to all of it. So we're really trying to strengthen communication channels when it comes to the testing task force. And I believe we're doing a great job. The partners have really come to the table to help with that. And like I said, Amber has been phenomenal. We had one of the epidemiologists with us yesterday at the task force, and Anna was awesome. So thank you, Amber, for that referral as well. Other than that, we've got our original, what we call Resource Relief and Assistance Task Force. And that's where everything kind of came and was born out of. So that we had our first meeting yesterday as well, and renewed our efforts. And we have identified some liability issues that businesses are concerned about that we need to talk about, our inland Viscerong tool, and some other resources that we need to keep an eye on, SBA, Paycheck Protection Program, some questions regarding forgivable loan portion, how they apply for that. So those issues are still being addressed through that group. And so I encourage any of you to reach out if you would like to help us. We do need some additional help and we always need some feedback and insight. But I'll take any questions if anybody's got a question through chat or anything about our task force.
All right, thanks, Cindy. And again, questions for the call today, just type in the chat box, utilize that, please. First name, last name, organization if possible, and then we can circle through those. We should have some additional time on the call today to circle back on questions, as well as our group at the Valley Chamber is always willing to follow up and get you connected with the appropriate speaker to get your question answered. So you can email us at info@SpokaneValleyChamber.org. I'll call and throw that in the chat box there for you to be able to access. Toby, I believe you're on the line, and put you on the spot here if you wanted to give just a brief update coming back into the office here. Welcome you to the mic.
No, thank you, Lance. I appreciate that. No, just back in the swing of things over here at the West Plains Chamber, we just want to say that we appreciate the just the collaborative just partnership that we have with our fellow chambers. So the only thing we want to report, it's nice that it's not just a cliche, but we're stronger together. So it's encouraging just the partnership between the Valley Chamber and Greater Spokane Incorporated and Visit Spokane and all those other ones. And so, yeah, together we are greater and we're going to get through this. So we just appreciate the opportunity and we're excited. We've got a whole new set of challenges. They're different than when we started. And so these calls are just as important as they were in the beginning. So thank you for Lance and his team for continuing to put these on.
Definitely good to have you back in the office, Toby. At this time, we're going to jump into the speaker slides here. So again, we have Amber Liner with us from the Spokane Regional Health District. Amber, I'm going to turn it over to you to get started, and then we'll wrap up with Gary and his team at Incyte. And so I'm going to stop my share because I know you have some slides to share, so you'll be able to access the screen now.
Wonderful, thank you. And thanks again for the invitation. And if you heard me speak earlier this week, a lot of this is going to sound familiar. I'm going to try to share my screen here. It says host disabled participant screen sharing.
I can fix that.
All right. And what I'm planning to talk about here with y'all today is just to give you a quick update on where the numbers are today, and how we're measuring success in this pandemic. And then I have some data that I can share about where we are today in Spokane County, and some suggestions for businesses on how you can help us keep this all under control and help us move on to phase 2. Oh my goodness, yes, share screen. All right, I think that worked. Anybody want to give me a thumbs up? Can you see my screen? Thank you. All right. So these are, this does not, you might have heard about the phase 2 variance request that the health district submitted yesterday afternoon to Secretary Weisman and the Department of Health at the state, requesting us to move to phase 2 immediately. And these metrics here are not the ones that are used to determine whether we are able to or ready to move to phase 2, but they are how the state has told us that they're going to be tracking success. So I do imagine that they'll be continuing to look at these metrics throughout as we move through phase 1 and phase 2 to see how well we are doing and if we're staying in the green or starting to move towards the red. The one metric here that I'll highlight is around COVID-19 disease activity, and the requirement to apply for variance to move to phase 2 says that we need to have less than 10 cases per 100,000 of our population. Depending on your calculation, and math is not my strong suit, that comes out to about 51 or 52 cases over a 2-week span for Spokane County. As of today, in the last 2 weeks, we have had 51 cases. So it's important to keep these case counts down. I am a little worried about how that looks now that we've requested variance. We're also trying to keep an eye on that R0. That's that value of how fast the virus spreads. We call it the reproductive rate. If it's 1 or less, that means that each person who's infected can infect 1 or fewer other people. We're keeping an eye on testing capacity and availability. I know Cindy spoke to that. We currently do think that we have plenty of capacity for the number of tests that we need to do to stay in the green here. And we're looking as well at the time that it takes from people once they've had symptoms to the time that they go get tested. And case and contact investigations, they are hoping for us to be able to follow up on 90% of cases within 24 hours and 80% of contacts within 48 hours. And as far as risks to vulnerable, I don't know if I can close this little guy there, there we go. Risks to vulnerable populations, we're tracking outbreaks in facilities, workplaces, and institutions. And to stay in the green there, we need to have less than 2 outbreaks. And then our hospital bed capacity, we're keeping an eye on how many beds are occupied by patients in general. And then they also want us to have less than 10% occupied by suspected and confirmed COVID cases. So here's how we're doing in Spokane County. Up through the 17th, we'd only had 34 new cases. As of today, we had an additional 13 cases, which is disappointing. We've had some really great trends recently. And like I said, our capacity for testing appears to be spot on. We're in the green there. We are equipped to handle case and contact investigations with 16 staff and 12 volunteers ready to go right now. And then we'll have plenty of additional volunteers activated by mid-June. We do have a number of outbreaks right now. There are more than 2, so we are in the red there, but we included a description of our plan to handle those, track them, and get them under control in our request for variance. The chat box is going crazy. I'm going to take a second here to just see what is going on, if there's anything that I can answer. Are you aware of where the additional 13 cases came from? We do know that 7 of those cases came from a workplace outbreak. I don't think that I can tell you where it was, but it was a something that happened in a workplace. I can make these slides available, sure. Okay. So, and then as far as healthcare system readiness, our beds are currently available. We're doing great for our healthcare system. And then some suggestions for businesses on how you can help us stay in the green with these. To help us keep our disease activity low, I would love businesses to make sure that staff who are sick or who've been in contact with anyone who is COVID positive, that they are strongly encouraged to stay home for at least 2 weeks and that they have what they need, whether that's paid sick leave or, okay. Or other resources that they have so they can stay home. As far as testing, again, encouraging staff who have symptoms, or if they feel like maybe they've come in contact with someone who had coronavirus, to just go ahead and get tested. And we do recommend using the tests that are available through our current healthcare systems and clinics and the labs that are certified and approved by the FDA. You can help with contact tracing by just maintaining a current contact information for staff. If you can track where they are during the day or who they typically sit next to, so that we can get those contacts under control right away and get in touch with them and let them know that they might have been exposed. As far as preventing outbreaks in workplaces, that is where we're seeing a lot of our cases come from, are either in workplaces, in long-term care facilities, or other institutional settings. So ensuring that there is enough PPE for staff or customers, other folks who are coming in. Masks are obviously going to be very important moving forward with the health officer's new directive. And then ensuring that businesses have the guidelines from the state and that they have what they need to meet those guidelines. I put a little star next to that because you might have seen the health district's resource on baseline checklist for businesses who are reopening. I don't recommend that you use that. I highly recommend that you refer to the state guidelines for businesses for your sector. If your sector doesn't have guidelines yet, then you can refer to the other sectors that have guidelines to see what kinds of things are coming from those, to get a sense for what kind of PPE you might need or start thinking ahead. But what we're hearing from the state is that businesses are required to have those guidelines in place and be able to follow them before they can open. Just encouraging proper safety, physical distancing, appropriate cough etiquette and hygiene in your businesses, and cleaning as much as possible. And then just help us keep our healthcare systems ready to handle any spiking cases by keeping those case counts low, increasing testing, and following guidelines. And that's all I have for slides, but Lance also asked me to speak to enforcement. And so I will say, especially with the news, there's a lot of news this week about some businesses that are opening right now ahead of when the state phase says that they can open. And there are a few different ways that folks could be submitting complaints about businesses or individuals that they think are operating in ways that are unsafe. And we only really have control over the reports that are made locally. So if you send an email to Inland Biz Compliance, Inland BIZ Compliance, I can put that in the chat box, at SpokaneCounty.org. That goes to the county sheriff's office, and they either forward that to the health district if it's like a food establishment, or they might keep it for themselves. And then we'll investigate, follow up with a phone call, maybe a visit, but really at first the goal is just to educate and raise awareness, assuming that businesses just don't know that they're not supposed to be open, or that they have, we're assuming good intent all around. So the first approach, the first touch point would just be to try to help those businesses understand the situation and ask them to comply with the guidelines. And that would happen a number of times before we would ever seek anything punitive. But if those complaints are made at the state level, either to the state DOH, LNI, Liquor and Cannabis Board, those are out of our hands. And so I'm not sure how those would be enforced, but I can just speak to the local enforcement. I see a question from Darren Watkins. Has the governor set out case number guidelines for moving into phase 3 and 4? As of right now, there are no guidelines for moving to phase 3. We expect those to come out closer to, a few weeks from now. Things seem to be coming out of the state very much right at the moment that you need them. And so I am happy to try to answer any questions or just keep an eye on the chat box, and I can try to respond to questions in there.
Thank you, Amber. I know we had a couple questions submitted beforehand and then a few earlier in the call. So one question, Greg Francis with ALSC Architects. As a business, what is the best way to coordinate with Spokane Regional Health District if they find an employee becomes infected with COVID-19?
Well, if that employee was tested through a lab, a clinic, then their positive results will come to us, and we will reach out to that person and follow up with them, let them know that they do need to stay isolated in their home for 14 days, and we have folks who can help set them up with food if they need groceries delivered or if they need health care, whatever they need so that they do feel comfortable staying isolated in their home, or if they are, you know, if they're doubling up or have a lot of people in their household and they need somewhere else to isolate, there are facilities that can handle that as well. And then we would do any sort of contact investigation, so asking that person who they came in contact with. If that happened in the workplace, we would follow up with folks in the workplace to let them know that they came into contact with someone who now has coronavirus and that they need to quarantine for 14 days. So I would say that the health district would handle that. If an employer has questions for the health district, you can call our informational phone number. Let me see if I can find out what that line is. I'll find out what the phone number is, and I'll put it in the box, the chat box. And then we could have someone follow up with a phone call.
And we'll provide that number in the follow-up recap email for the call as well. Another question, as we enter phase 2 here, should businesses still be encouraging / requiring in some industries telecommuting? And then as subsequent phases, is that all set out by the state guidelines?
Yeah, it should. The state guidelines, if you've had a chance to look, are very detailed and prescriptive. So my suggestion would be to continue to use telework where it's possible. In cases where it's just not possible, you'd have to refer to those guidelines. But if able, if it works for your type of business, then that's definitely a way to keep folks safe.
And then another question related to kind of senior or community center style businesses. There's some questions around where they fit in phase 2 or phase 3 as far as opening up operations to visitors and subsequent other elements of operating more openly. Can you elaborate on where they fit into that metric?
Yeah, so for those, that's a great point. That I don't think that they are explicitly called out in the governor's phases. I would refer, I'm trying to pull up the phased approach document here. I would refer to the section of the plan that indicates the number of folks who are allowed to come together. So right now in phase 1, it's less than 5, or maybe that's phase 2 here, let's see. Gather with no more than 5 people. So I would just keep an eye on that. Phase 3 is gatherings of no more than 50. And they do say, like all other businesses, not listed. So I think that would be, if you can keep it less than 50, that would be probably phase 3. If it's larger gatherings, that looks like it's not until phase 4.
And then last one that just came in there in the chat box, if you want to respond to that one.
Yeah, if an employee tests positive for COVID, as business owners, do we begin the contact tracing procedure, or do we rely on SRHD and the county officials to do that? We will do that. As the health district will do that, and our cohort of volunteers. So we do have to follow HIPAA guidelines, the same guidance that the medical field has to follow, public health follows. We will not share the name of somebody. So my coworkers will not get a phone call that says Amber has COVID. Everybody shame her when she comes back. And if you came within 6 feet, then stay home. We'll protect that employee's identity. We won't share that with anyone. We will ask them permission to share their name. If they grant it, then we might tell you who that person is, but more likely it would be our volunteers or our staff calling close contacts and saying, at some point on Monday between noon and 8, you were possibly exposed. you should stay home. So we'll handle that. If you find out about someone who has been diagnosed positive and you're worried that somehow either they didn't go through a lab that would have notified us, or if you have any concerns or questions, don't hesitate to reach out to public health. I know, unfortunately, for a number of businesses, especially if you're a food establishment or a pool, your experience with public health has been more of along our regulatory side, but that's just a sliver of what we do. And we really do want to be a resource to help you. We want to move to phase 2 as much as everyone does. And we want to be able to stay there and move on to phase 3. So please look to public health as a resource to help you plan for safety. And if you have questions, we can answer questions and concerns. Is there funding available to support businesses and nonprofits in purchasing PPE? That's a great question for probably someone else. I'm thinking, Cindy, you might have more information on this.
We can chime in here, and actually, as part of that question, Lisa, that wasn't a plant, but thank you for asking that. I know we're going to launch a little poll question here that should pop up to the group, and the question being, this is one of the components the chamber work groups have been looking at as part of our recovery grant program, and whether funding for strictly PPE style grants would be utilized by the business community if it was a simple application. And so we appreciate you throwing your response up there in that poll. We'll share those results with the group here that's on the call. I know it is an element that's been in the news a lot. It's a highly debated element. I know Dr. Lutz's recent directive, which is a recommendation, again, not enforceable, as Amber had said, by law, but definitely a recommendation for safe work environments and safe consumer environments. They're recommending masks now, and as the last 24 hours shows, that is a component that we are very divided on as a community. And so we do have some documents that we'll make available that Spokane Regional Health District has put out for hanging in your storefront, asking customers to embrace the masking should that be an area that you support. It is out there for the ability to help everybody in the community, I guess. And so that's a component we're looking at, trying to establish a grant funding program for Spokane County businesses to acquire those products. And so it looks like final question down here from, or statement, I guess, is just getting into the pool of purchasing. And so an update that we can give you there is that we do have a regional marketplace being stood up for that through our state level Chamber of Commerce, AWB. And so by Friday, we should have that portal available. We've been funneling manufacturers that are local to the state of Washington here into that. And then as part of our group, we actually requested they add a zip code element to that, to where you can find local production streams to be able to get these materials quicker, as well as at a fair price point. And so that should be available. You'll see those links once the portal is open come out from both our Inland Strong Biz newsletter as well as our various chamber direct newsletters. And so just keep your eyes open for that. Again, should be there. We're jumping ahead here, obviously, as phase 2, it looks like we're going to qualify. And so we're hopeful to have that ready by June 1 for phase 2's current timeline. Since we're going to be potentially approved early, we're going to be right on schedule for that. And so again, it's just a matter of working as hard as we can from the business community stance to provide supply chains here locally to get these supplies to the business community here. So I think that I want to give Amber a break here, and I want to pivot over and talk a little bit on the testing front, and excited to have Gary Gemar from Incyte Diagnostics on the line. Gary, I know, throw it over to you. As I do so, I want to say thank you to your group. You've been a fantastic local business here for, I forget the total number of years. I know you've been a Valley Chamber member for over 50 years. So thank you for the support of our organization. And I just want to welcome you to the line here to give an update on regional capacity when it comes to testing. I know there's some exciting new developments with your onlining of your new diagnostics lab. And so I'll throw it over to you at this time.
Okay, thanks, Lance. And greetings to everyone who's on the Zoom meeting. And I would like to introduce Dr. Cristina Huang. She's our clinical pathologist. And if there's any technical questions that I can't answer, I will kick them over to her to help answer. But yeah, what I want to do is kind of give everybody a quick background on who Incyte Pathology is and kind of our path to getting both the viral load testing online, which is used to diagnose the infection, and then talk a little bit about getting antibody testing up and running too in our laboratory. Some quick background on Incyte. We've been open since 1957 as an anatomic pathology laboratory. And again, anatomic pathology deals with biopsies and tissues from surgery that come to our pathologists to make diagnosis. Another big aspect of anatomic pathology is cervical cancer screens, Pap screens. So we also do that business. And then we would have never predicted a year and a half ago when we planned to open a new clinical lab that we would open it in the middle of a COVID-19 pandemic. So we opened our clinical lab on March 23rd to pretty much everybody staying at home. So it's open, but it's been a slow rollout. We serve 5 states, Montana, Idaho, Washington, Oregon, and Alaska. And we have 3 facilities, well, actually 4 if you consider the clinical lab, because we have our anatomic path laboratory in the Spokane Valley on Mansfield, and our new clinical lab is in the Spokane Valley off of Sullivan and Marietta. We have another anatomic path processing center in Richland, Washington, and another anatomic path processing center in Bellevue, Washington. And to give you an idea, we serve over 50 hospitals. So now kind of moving into the challenges of getting our viral load assay up first. You know, when the pandemic broke out in March, we do have the equipment in-house to do this testing, because the same platform that we test infectious diseases and HPV for cervical cancer screens had the ability to do the testing for viral load. Our challenge, though, was when we talked to the vendor, they basically were allocating all the reagents to various locations throughout the nation that had the outbreaks. So it took us all the way to early April just to get a kit to do the validation on our platform. And so that's when we started the validation. We completed the validation by mid-April. And then at that point, we learned that Hologic could allocate 5,000 tests to us per month. So that was a good initial allocation, but the additional challenge we had was we could not find collection swabs and transport media. And so in order to launch, which we did launch at the end of April, we actually had to partner up with another laboratory who was testing, and we got an initial stock of swabs and transport media. And then that allowed us to launch on April 29th. That launch was somewhat limited, again, because of our collection and testing capacity, but we launched it with a lot of the smaller hospitals in the region who are having their own problems getting reagents and collection supplies or even instrumentation to do the testing at their hospitals. So we launched it with those smaller hospitals, and then at that point, when we continued to have issues with reagent allocation and supplies to collect the test or the swabs, we also made the decision to set up a second assay. And so at that point, we worked with another vendor, got a second assay in-house, the equipment, supplies, reagents, and then we started validating the reagents in mid-May here. So we started the validation this week, and we're looking to wrap up validation probably by the end of the month so we can launch a second assay in June. Once we launch both assays, we'll have a capacity to do around 1,500 tests a day. Again, are we going to get that many? Only time will tell, but we'll have that capacity in the early part of June. And then what we're seeing right now, besides supporting those smaller hospitals, with the opening of elective surgeries again, we're starting to see a big demand now for pre-surgical work on patients. And then another demand that's coming our way is testing OBGYN patients. So the hospitals pretty much know they've been screened before they go in for delivery. The other area that we're getting a lot of queries on for testing is businesses, schools and universities, and really they're starting to kind of plan, how are they going to open. Again, we continue those conversations, but that's kind of where we are with those two assays. And then the good news basically that happened this week is when we're talking to vendors, we're finally starting to get an indication that they're catching up on manufacturing reagents and collection supplies, because we were actually able to order 15,000 swabs this early or late last week, and they actually didn't put them on back order, and we're actually going to get them next week. So that's a good sign, because collection swabs were pretty much impossible to find unless you outsourced and going to China. So anyway, that's a quick background on the viral load assay that is used for diagnosing the infection. The other test area is the antibody test, and again, I know there's a lot of interest in the antibody test just to try to determine the epidemiological situations in various communities, and how many people really were infected, we didn't know, and some of this herd immunity is starting to develop. So as far as antibody testing, the first thing we noticed was probably about 3.5 weeks ago, 4 weeks ago, there was a huge bolus of vendors that flooded the market with these rapid cartridge tests that you could basically get an answer in 5 to 15 minutes. It was 5 minutes if it was positive, 15 minutes you had to wait if it was negative. The problem with those initial tests, when you read closely the package insert, was they really couldn't distinguish between a COVID antibody or antibodies to the common cold, which pretty much made that test worthless. And if you were following kind of the continuous news on the antibody test, the FDA actually reined a lot of those manufacturers in, and they had to go through an official EUA emergency use authorization approval. So anyway, we were waiting and watching the various vendors to see a good test that was going to hit the market. And the test we eventually settled on is one that's run on our chemistry and immunochemistry analyzer in the new clinical lab, and it's manufactured by Roche. And again, when you look at their assay, it did receive emergency use approval from the FDA on the 11th of May. We got the reagents in on the 12th, and we completed validations by the 15th. So we're ready to put that test online. And the good news with that assay is in the studies that are presented, there was no cross-reactivity of the common cold viruses that the other assays have a problem with. So anyway, we're ready to launch that test. And again, I guess we are just waiting to see how the public's going to really want to look at the test. There's a lot of interest, but I think a lot of people have read that if you do have the antibodies, it's no guarantee that you're immune. So they're really not stepping out and saying you're protected. As far as antibody testing, we have huge capacity to run the testing. Again, we'll have to see where it's going to come from, but the analyzers that we have, basically, we can run 300 tests an hour. So it's got high throughput. So anyway, that's a quick background where we are. And as far as antibody capabilities for testing, right now we're getting allocated 1,400 tests a week. And we have the ability to increase if it goes beyond that. So again, we have good capacity on doing the antibody testing. So anyway, I think at this point, Lance, I think we can just open it up for questions.
Yeah, Gary, one of the questions that came in is in regards to businesses who decide they'd like to test their employees as part of a return to work strategy. I know we had talked on our planning call about this. Without naming names, we do have employers here locally who are looking at this. One element remains that they need to have a prescribing physician to order the test, but the local capacity is there with our labs, whether it's your guys' team. I know LabCorp's got capacity to run these as well. And so can you talk through a process that a business would need to run through to establish an agreement to send staff in for whether it's the COVID-19 test or the antibody testing, and what that process would look like?
Yeah, so again, we're having those conversations because we have been contacted by some of the businesses that want to test. And the best approach would be to contact our sales department. And Nate Koenig is our Chief Marketing Officer, and so he would be the contact here at Incyte. And then his sales team would go out and work with the businesses to set up a program for testing. So again, so everyone knows, the difference between the viral load assay is a nasopharyngeal swab, an oral pharyngeal swab, or a nasal swab. The antibody test is actually a blood draw. So with launching our clinical lab in the Spokane region, we have 4 patient service centers where phlebotomy can be done, and they're located on our website. Once people, start wanting to order the test, and I think one of the big discussions we had in planning, Lance, was if businesses are looking to test, is there going to be some kind of an ordering physician that orders the test for the business versus, again, if a business has 200 employees and the employees have to reach out and have their provider order the test for each one of them. That's kind of a whole big challenge in itself. So I think that's something businesses are going to have to kind of work on. Are they going to work and order it with a third-party physician, or are they going to have their employees work with their own physicians to order the testing?
Yeah, and definitely a challenge. A benefit, we have the testing capacity now coming online at the same time that we see the movement into phase 2 and a broader group of our workforce headed back to work. Obviously, again, looking at that balance, it's something that we, from a chamber perspective across the board, we would recommend you talk with your attorneys, your business attorneys, as well as your healthcare brokerage firms or providers to understand what the recommendation would be, and whether that's a program you want to set up as part of your return to work strategy. It's certainly the element of liability that lies within this next phase of us all coming back into our office spaces and resuming normal activity is probably the biggest unknown. We can't speak to a lot of that yet because the policy is just not there. Much like how Amber had referred to the unfortunate aspect of us receiving guidance from the state often the week of or the days before the phase timing is hitting. It's one of those that we are facilitating a lot of information, unfortunately, a lot of the times at the last minute. But again, it's as we work through it to understand the policy and continue to provide the best insight we can. A good part right now is that we do have testing capacity now available. And it sounds like the supply chain for testing supplies is starting to iron out for companies like Incyte here. And so that's a real positive to hear. I wanted to share, we did have that poll that we had earlier. I want to share those results there with the group. And so about 3/4 of you would be interested, and so it is a work stream that we are actively working on, trying to establish a grant pool of funding to allow businesses to offset the cost of PPE. I would imagine within that, testing may be a portion that would be considered in a grant reimbursable area. And so again, we'll just continue to work on that. That is a top priority for our workflow on the recovery aspect. And so our various entities that have received CARES funding in both the major cities in our community as well as the county. There's a lot of potential there. And then looking back, encourage anybody with additional testing questions. You can throw those in the chat box. I know Cindy and Colin have provided a couple of the links to anyone on our end that's a manufacturer who is manufacturing supplies. They can submit their organization into that supply portal chain. And then as that tool, that marketplace launches, again, it'll be another resource for businesses looking for specific PPE elements. You're able to submit what you're looking for and get a customized RFP back from businesses, sorted actually by zip code, so you can reach out to those who are local to you first and establish those potential supply chains directly to you there as a nice benefit. So with that, I want to, anything from Amber or Gary here, just as kind of final closing comments. I know we're going to wrap up a few minutes early. Everybody can appreciate that going into a Friday, or excuse me, a Thursday afternoon, and then a Friday before a holiday weekend. We'll give you 12 minutes back of your day, unless there are any additional questions. We do have the ability, if you have additional questions that you think of after the fact, again, our Valley Chamber email address, info@SpokaneValleyChamber.org. We're happy to connect you with the appropriate resource. For next week's call, our plan is to focus on PPP forgiveness. And so we'll have the SBA back on the line, as well as some local lenders and CPA firms back on to answer questions. Again, that guidance came out for PPP forgiveness as of early this week. They asked for some time to digest those policies to be able to formulate good plans. We have been sharing, the U.S. Chamber came out with a great guidance overview document, and then we'll dive into that on a deeper level next Thursday from 11 to noon. So at this time, not seeing any additional questions. I want to thank Amber and Gary and your guys' teams for joining us this morning and providing this update. I will encourage businesses to, again, as we see guidance on whether we're allowed the variants to move into phase 2, listening to Amber, knowing where we're at, we are still very close on that threshold. And so safe business operations, following the guidance that's out there from both the state and our local health districts to remain flattening that curve and keeping the numbers down will ultimately be what keeps our businesses open once we are able to open here. And so that is a critical element that we as a business community can't stress anymore. Certainly we need to keep those case counts down. We don't want to slide backwards back into phase 1 at the point of moving forward here. So Again, thank you to everyone on the line. Thank you, Amber and Gary, for your willingness to share these details with us. And at this time, we will provide a call recap email by the end of the day with a link to the video as well as the Q&A. So just keep an eye out for that. We look forward to having you join us next week, Thursday, 11 to noon, again, for a discussion on PPP forgiveness. Thank you again, and we are adjourned.